Well, I would like to welcome you this afternoon. It's a little bit after 12 o'clock, and especially want to thank the Georgia Alzheimer's Association and also the National Alzheimer's Association. And as everyone knows, in the state of Georgia, we have been working on Alzheimer's in particular and related dementia for many years now. And I'm kind of in the sunlight of sunshine, sunlight, sundown, whatever you want to call it, of my own career. And after being elected 30 years, you kind of put things in retrospective order. And one of the things that I look at is the past 10 years of when I have worked on the issue of dementia. And when you look at your success stories and what is your purpose in life, you really begin to understand what's important and what's not important. And the issue of dementia, of course, is so important in the United States because of my generation, the generation of the baby boomers. And I'm 64 years old, and what's amazing to me is when I first started working on this issue, you were thinking about a different generation. You were thinking about the World War II veterans and the greatest generation. But now here we are right here in the throes of taking care of the baby boomers. The other thing that's interesting and has been so transparent is the fact that dementia affects so many state agencies. If you look at the overall budget of the state of Georgia and whether it's $25 or $26 billion, you understand the different agencies that are affected when you are taking a holistic approach of taking care of a generation of people. And whether it's community-based services, whether it's behavioral health, whether it's public health, looking at statistics, whether you look at aging people in the correction system, it affects every single agency that I can think of, even the Board of Regents, when you think about college professors retiring. It's been my pleasure to work with Emory University and work with the Brain Health Center and work on the issue of research into dementia. And I think of all the projects we've done is Alzheimer's bringing the different agencies together and working on the hub and spoke system and the research centers, the academic centers of reaching into the rural areas. It's been a success story with all the conflict that we often have between the House and the Senate. We meet quarterly with GARD, and we've done and had a great success story. I am going to turn it over to the Alzheimer's Association and let them do their rollout of their annual statistics. And one of the most important things and obligations that I have, my fiduciary responsibility, is the 140,000 Georgians that do exist with Alzheimer's. And I do believe and know so many people and feel like it's underreported. My mother-in-law passed away this year right after we started session, and she had dementia. And it was just amazing how many people came to the funeral home and said, I have so-and-so at home. And I know it's exactly underrated and underreported. And the reason we know that is because all of the senators and all the representatives get requests for services. And usually those are community-based services. And that's where our biggest deficit is. And that's where we rely upon agencies like the Alzheimer's Association filling in the gaps, because we know government can't be all things for all people. So we have the hashtag End Alzheimer's, and we're delighted to promote that on Twitter and also at Alz Impact, I guess. Alz Impact, that's it. That's a great hashtag and a great slogan to be able to remember. So with that, as you know, Representative Cooper is supposed to be here to finish up. We're delighted to have all the commissioners here, and we appreciate y'all. We know you're just as busy as we are because y'all are tracking us. And I have a caucus meeting that I have to go to. But if you have further questions, I'll be available this afternoon. I'll be here all day. And, of course, I'll have the committee meeting in a little while. And I'll be here bright and early in the morning. So I'm going to turn this over to Linda Davidson. and she's going to present the facts and figures.
Thank you so much. This morning, the Alzheimer's Association 2018 Disease Facts and Figures Report was published. Both of these boards are indicative of some of the data that we're talking about today. Overall data on the disease and its impact on the nation's healthcare system, published annually. The data we are sharing is important because it allows for us to better plan our services, our advocacy work, and future funding for care for people who are now living with Alzheimer's and future generations. The impact, as you know, is huge. 5.7 million in the United States with Alzheimer's or dementia, 140,000 people right here in Georgia, and we do know it's underreported. There's many more. Georgia is expected to see another increase, 35% incidence by 2025, and that's only 7 years from now. Mortality from Alzheimer's continues to rise. Between the years 2000 and 2015, we saw a 201% increase in Georgia. And as you know, we continue to tell you that it's the sixth leading cause of death here in Georgia. 527,000 unpaid caregivers in Georgia. 60% are women. 600 million unpaid total hours of care equals $7.5 billion in total value of that unpaid care. According to the 2016 Behavior Risk Factor Surveillance Systems, more than 40% of all adults providing unpaid care to loved ones with Alzheimer's or dementia have been doing it for at least 2 years. More than 30% of caregivers provide 20 or more hours a week. Nearly 1 in 4 dementia caregivers are in that sandwich generation, caring for both someone with dementia and with a child or a grandchild. 80% manage a household care, such as cleaning and cooking, and 72% manage personal care, feeding and training. 22% have a history of depression. The costs continue to rise. Dementia is one of the costliest conditions in society. Total payments for caring for Americans aged 65 and older with Alzheimer's or dementia will surpass $250 billion. That increase is $20 billion from last year. $20 billion. In 2018, $1.1 billion in Medicaid cost of caring for people with Alzheimer's. There will be a 40% change in cost from 2018 to 2025, and $23,240 is the per capita Medicare spending on people with dementia in 2017. What we're doing right here in Georgia with the Georgia chapter of the Alzheimer's Association, we want to provide more services to those living here in Georgia. We want to grow our volunteer base so that we can provide more services out in all the counties here in Georgia. We want to continue to support and increase federal funding for research, and again remind you that we are the largest funder of research in this country next to the federal government. We have lots of work to do, and it takes all of us working together. Appreciate all that you're doing. It's my pleasure now to introduce Commissioner Robin Crittenton.
Thank you. Good afternoon. My name is Robin Crittenton, and I'm Commissioner of the Georgia Department of Human Services. Alzheimer's and related dementias touch the lives of countless people. No doubt, most of you, perhaps all of you, are thinking about someone very dear today as we discuss this issue. Here in Georgia, we face a profound challenge in the coming years. As our 60 and older population grows, so too will the number of people living with Alzheimer's, far faster than in most other states. In fact, by 2020, according to Alzheimer's Association's projections, the number of Georgians living with the disease will grow by 35%, from 140,000 to 190,000. The need for Georgia to become more dementia capable is self-evident. The 2018 Alzheimer's Facts and Figures report is an important guide in that process. The Georgia Alzheimer's and Related Dementia State Plan Collaborative is a structured group of experts and agencies dedicated to working together and has been a catalyst to expanding services to people living with dementia. In state fiscal year 2017, the Advisory Council and collaborating organizations made advancements in research, workforce development, partnerships, and other areas. Yesterday, the Georgia House of Representatives passed legislation introduced by Senator Unterman to reauthorize the Advisory Council as part of the governor's approved Georgia Alzheimer's and Related Dementia State Plan. The Senator Ross Tolleson Act now goes to Governor Deal for his signature. The Advisory Council brings together state agencies, medical and service providers, advisory groups like the Georgia chapter of the Alzheimer's Association, and other stakeholders in the well-being of older Georgians to discover ways the state can serve effectively. Research done as part of the state plan and detailed in the Alzheimer's Facts and Figures report show that early detection is key to addressing this critical issue. Putting mechanisms in place that help with the early detection and diagnosis of this disease is how we change the story for so many of our older Georgians. Last year, the General Assembly allocated more than $4 million to begin establishing sites across the state that will assist in the early detection of Alzheimer's. This is the Georgia Alzheimer's Project. I'm happy to say that with help from our partner, Emory University, we are on schedule to reach our goal of establishing 5 memory assessment centers by the end of state fiscal year 2018. The centers, or MACs as they are called, assist patients in getting connected to support services appropriate to their care needs. A social worker or similar professional will be in each MAC for this purpose. Emory has partnered with institutions such as Mercer University, Morehouse School of Medicine, and Medical College of Georgia to establish the MAC sites. The 5 centers to be established this year are in Augusta, Atlanta, Macon, Columbus, and Albany. The work of the GUARD Advisory Council and the Georgia Alzheimer's Project, coupled with the research and data from the Alzheimer's Facts and Figures report, will be vital to our continued efforts to build a strong and far-reaching network of support for people living with dementias. Governor Deal, the legislature, and the Department of Human Services remain committed to helping older Georgians, people with disabilities, their families, and caregivers to achieve safe, healthy, independent, and self-reliant lives. And we are grateful to have so many partners to carry out this important work. Thank you for your partnership in helping us to build stronger families for a stronger Georgia. Thank you.
Good afternoon. I'm Dr. Patrick O'Neill, Commissioner of Public Health here in Georgia, and I'll start off talking a bit about the circumstances of today in a personal way, just like Senator Unterman did. She was talking about being at a phase of life, and she described it kind of as the sun was up, the sun was maybe beginning to set, and we share something. Senator Unterman, in her younger years, was an emergency department nurse, at the same time that I was an emergency department physician for some 29 years. I'm now, as of May of this year, going into my 50th year as a licensed physician. So it is kind of sunset time, and I think that at this age group, and I will be 76 in another couple of weeks, it makes me focus heavily on the importance of dealing with Alzheimer's and other dementias in Georgia. Also, on a personal note, I had the great pleasure and privilege of taking care of my mother in my home for 10 years. And the last 2 years, she had dementia. She was fortunate. She did not develop dementia until she turned 100, and she survived almost to 102. but I had the great opportunity to care for her in my home. And from a personal perspective, I think that gave me an even added interest in what we're doing today. From a public health perspective, I also want to mention that Alzheimer's and related dementias are a crisis. And you've heard the numbers. I think Linda did a fantastic job of talking about that, as did Commissioner Crittenton. The numbers are staggering. Whenever we have a huge prevalence of disease in our state, that of itself makes it a public health crisis. In addition to that, when you have a disease that creates the 6th major cause of death in our state, that too makes it a public health crisis. The legislature saw fit in 2014 to award the Department of Public Health the responsibility of developing the Alzheimer's and related dementias registry. Now, why did that happen? Well, I think one reason is that in public health, we are the agency that really deals with data and data analytics. And there was a realization that we know that we have huge numbers, prevalence of disease of Alzheimer's in this state. We know that based on national statistics and basically on translations of that to Georgia. But we really need very specific information on exactly what are our numbers, and not only what the numbers are, but how those folks line out. We need to look at gender. We need to look at age groups. We need to look at ethnic backgrounds. We need to look at racial backgrounds, because another thing that makes this a crisis in public health is that we have good reason to believe that there are major disparities. And one of the things that public health has a responsibility for in this state is dealing with health disparities. There is a disproportionately large number of African American and Hispanic individuals that come down with Alzheimer's or related dementias. That, again, makes this a public health crisis. So we have many, many reasons in public health to be very concerned about this issue, and not only to be concerned, but to participate with so many partners in addressing what we can do from a public health perspective in this disease and other dementias as well. Having said those things, the other thing I want to mention today is that there is a fantastically interesting legislation pending, not just here in Georgia, but at the national level. And it's called the BOLD Act, B-O-L-D. And it's building our largest dementia infrastructure for Alzheimer's. And that's really fascinating also from a public health perspective, because that act, if it passes, and it's been introduced in the Senate and in the House at the national level, if that act passes, and there's every expectation that it will, it's going to do something that I think will be extraordinarily valuable from a public health perspective. It's going to create centers of excellence. And what do we do with centers of excellence? But we learn valuable lessons. We learn what works and what doesn't work in addressing this disease. It's going to give us opportunities to award grants to do very special things here in Georgia, and obviously in other states as well. So I see that the BOLD Act is going to be something that potentially could revolutionize what we do, not only here in this state, but across the country in addressing this crisis. And particularly, I'm impressed with the fact that, we're so interested in Georgia, not only in all the issues that, from a health perspective, impact us, but we're interested in economic development and how that plays into all the things that are important to us in our various agencies here in state government. Well, with the BOLD Act, there is the potential also for bringing additional jobs to the state of Georgia, which I think will be extraordinarily important. And one of the things that our administration, our governor, has been so supportive of through the years. So for many, many reasons, Alzheimer's and related dementias are of critical interest to us in the Department of Public Health and to our many other partners, not only outside of the realm of government, and we do have many partners there of great importance, as you know, but also our agencies within government. I can't tell you how important it is for the health agencies here in Georgia to work together. And I think Commissioner Crittenton would attest to the very same thing, that all 4 of our health agencies, community health, behavioral health, DHS, and DPH public health, work very effectively together. And I'm very proud of that. I think that our governor has done an extraordinary job of encouraging that, and we in Georgia are proud of it. And because of those partnerships within government, as well as outside of government, and the other organizations that we participate with, we are going to make a huge impact on improving the lives of those who live with Alzheimer's and other related dementias in Georgia. And eventually, I'm very hopeful, I'm optimistic, we're going to find a cure. Thank you very much.
Good afternoon. My name is Joe Hood. I'm Deputy Commissioner for the Department of Community Health, and I'm joined today with Melanie Simon, our Chief of the Health Facility Regulation Division for the Department of Community Health. We're here on behalf of Commissioner Berry, and we're pleased to be a part of this agenda and to partner with our other agencies within the state of Georgia for Alzheimer's issues. I want particularly to talk about a recent issue that we have pending in the legislature that will benefit the Alzheimer's community, I believe, in our venue, which is the licensure of long-term health facilities within the state of Georgia. And that's one of the governor's criminal justice reform bills, and it's Senate Bill 406. This is our background registry bill that was introduced and recommended by the governor, and it will for the first time allow us to do national fingerprint background checks on all owners, applicants, and employees of long-term care facilities such as nursing homes and home health. But additionally, as a part of that initiative, there is a caregiver registry proposed that the Department of Community Health will work on to allow those who care for individuals in their home who seek additional help, such as CNAs or other workers who would be there when they cannot be, to do a background check on a national level in a similar fashion as to the long-term care facilities that the first part of the bill employs. We're very hopeful that this will be beneficial to all those who care for the elderly in the community, but particularly I think that it benefits those who are challenged with dementia and are caring for those individuals, as those are our most vulnerable population in both our long-term care facilities and in our home facilities where we're looking for additional help. That bill has passed both the House and the Senate. It initiated in the Senate and will now go back for a simple agree in the Senate, so I'm very hopeful that we'll be working on that very soon. I wanted to allow Melanie to speak to Health Facility Regulation Divisions, particularly, and the staffing and surveys that we do in those facilities.
Thank you so much for the opportunity to participate in this forum today. As the regulatory arm of DCH, we do see people with Alzheimer's and dementia across the entire spectrum of healthcare in Georgia. And as we conduct our surveys and inspections, we look to make sure that they are safe, that they are receiving quality care, and care that supports a quality of life for these individuals. We were pleased last year to get some additional support that really helped us in our long-term care program, which of course is critical in addressing Alzheimer's in our state. We received funding for salary increases for our nurse surveyors in long-term care in last year's amended budget. This enabled us to fill vacancies in the program, resulting in more frequent inspections of nursing homes. We also, in February of 2017, implemented a program approved by the Governor's Office and the Department of Administrative Services known as Work on the Weekend, or WOW. This allowed us to send surveyors out on the weekend to investigate complaints in healthcare facilities in Georgia, including complaints of abuse, neglect, and exploitation that may involve people with Alzheimer's or dementia. Utilizing this program in less than 3 months, we investigated over 200 complaints and completely eliminated our backlog of complaints in the long-term care program. And then in August, we received a National Best Practices Award for the WOW program, and it's now being implemented in several other states. We do understand that surveying healthcare facilities on time and in a quality manner is critical to ensuring that Alzheimer's patients and residents of these facilities receive appropriate care and treatment. And I'm pleased to also tell you that in November, the Centers for Medicare and Medicaid Services implemented a new long-term care survey process that does include additional requirements associated specifically with behavioral health, including a focus on Alzheimer's and dementia as well. And then finally, I wanted to highlight we do award civil money penalty grants The Division of Healthcare Facility Regulation does this with the approval of CMS, and we have 4 right now that are targeted at Alzheimer's and dementia. One you may have heard of, it's known as the Virtual Dementia Tour, and it actually simulates what it is like to have dementia. It's a very valuable tool for training both our surveyors and for staff at nursing homes, and it shows them what it's like to suffer from this disease and gives them greater empathy in providing care for people suffering from Alzheimer's and dementia. We have a few other grants, a music and memory program that is supported by the Georgia Healthcare Association, a special sensory room for people with Alzheimer's, and a grant that utilizes assistive technology to improve the quality of life for Alzheimer's and dementia residents. So those are some of the things that we're doing. Very proud to participate today and certainly understand the importance of regulation and oversight in ensuring quality care for people suffering from both Alzheimer's and dementia in Georgia.
Hi, I'm Kathy Simpson, the Director of Public Policy and Advocacy for the Alzheimer's Association Georgia chapter, and I'm delighted to see such a great turnout today. Alzheimer's is the most under-recognized threat to public health in the 21st century. Quote from Dr. David Satcher, the former U.S. Surgeon General and Director of the Centers for Disease Control and Prevention. It's also the most expensive disease in America, and costs are set to skyrocket in the years ahead. To address the issue, Congress and states like Georgia must devote the resources necessary to achieve breakthroughs in both prevention and effective treatment of Alzheimer's and care and services for those living with it and those caregivers who care for those individuals. Back in 2012, an expert panel of scientists concluded that to achieve these tasks by 2025, there needed to be a national Alzheimer's plan. That plan was implemented. The first plan came out in 2012. Prior to that, across this country, many states created Alzheimer's and related dementia state plans. Georgia was a little behind the curve on that, but now is ahead of the curve in the implementation of that plan. Alzheimer's is the only leading cause of death in America without a way to prevent, cure, or even slow its progression. In Georgia, we are fortunate with all of the partnerships that we have, both in the community, private sector, and in state government. The Department of Human Services, Public Health, Area Agencies on Aging, Georgia Council on Aging, healthcare provider organizations, long-term care industry, private sector, and non-for-profit sector. Working independently, but also working together through the Georgia Alzheimer's and Related Dementia State Plan to allow us to address the issues that we have and to use the facts and figures, to use the behavioral risk factor surveillance system data for caregiving and for cognitive impairment to ensure that we effectively provide services, programs, research, public policy, and legislation to help make Georgia truly a dementia-capable state. The national plan has many requirements, but one of the things that we're excited about with the national plan is that Georgia works in tandem with that national plan, receiving funding through the Administration for Community Living and receiving funding from the Health and Human Services Department as well at the federal level. The facts and figures data that we work from, especially in public policy and legislation, like the legislation that Commissioner Crittenton mentioned earlier, and House Resolution 1292 that urges the Georgia Alzheimer's and Related Dementia State Plan to study providing access to quality long-term care for individuals with Alzheimer's disease or other related dementias. However, we have a call to action. These figures that we've talked about today sound dire, but there is hope. Working with the national plan and the Georgia Alzheimer's and Related Dementia State Plan, state government, and the community, there's something that each of us can do to change that trajectory. Learn about Alzheimer's and Related Dementia State Plan and join a work group or attend quarterly meetings. Volunteer, lead classes, educating caregivers, lead a support group, help with a walk, or advocate. Urge your members of Congress to support a $425 million increase for research funding at the National Institutes of Health. Scientists told us back in 2012 that we needed to ramp up to $2 billion per year by 2025 to change that trajectory. We are just under that amount now. That $425 million increase would put us right at the $2 billion mark. Urge your members of Congress to support the Bold Infrastructure for Alzheimer's Act that Dr. O'Neill mentioned. It establishes the centers of excellence across the country. It provides funding to state and local and private public health departments and increases the collection, analysis, and timely reporting of data. If you know someone who's experiencing one of the 10 warning signs of Alzheimer's, encourage them to visit their health care provider to receive an assessment to determine if they have mild cognitive impairment, Alzheimer's, or related dementia, or determine if there might be some other cause that could rule out dementia. Hopefully, with the 5 centers, memory assessment centers coming on across the state in June, we'll be able to have more early, accurate diagnosis of Alzheimer's so that people can better plan to care for individuals living with the disease, and so that those who are living with the disease have a better quality of life. Learn more about dementia and how it could impact you and your family. We, as a community partner, stand ready to serve anyone who has dementia, any form of dementia. You can reach us by our website at alz.org or through our 1-800-272-3900 helpline. Thank you for coming today. And it appears that Representative Cooper will not be able to join us. She had other commitments and was going to try to work us in. So we appreciate very much your coming and look forward to our continued relationships with all of our partners and new partners that perhaps the association has not worked with before. Thank you for coming.